Welcome to Boston Community Health. I'm Dr. Elias Thorne. Preventing a sudden vascular crisis does not require strenuous workouts. Today, I will demonstrate 5 simple home exercises designed to stimulate nitric oxide release and clear arterial plaque naturally. Most older adults mistakenly assume that shielding their cardiovascular system merely involves taking daily prescriptions, completely unaware that targeted mechanical movement performed at home represents the absolute key to activating your body's natural self-healing mechanisms. As we cross the age 60 milestone, a sedentary lifestyle or sitting comfortably in an armchair for extended hours forces your blood to circulate incredibly sluggishly within the microvascular network. This biological stagnation creates the perfect clinical environment for blood platelets to easily aggregate together, silently constructing dangerous arterial clots. Your vascular system requires a consistent mechanical stimulus to maintain the smooth, non-stick integrity of the endothelial lining. The 5 home exercises demonstrated today are organized as a synchronized protocol, successfully flushing your circulation without overloading an aging cardiovascular framework. We begin with our foundational home practice. Number 1. Brisk walking in place or moving continuously around your living space. This represents a basic physical movement that delivers an incredibly powerful biological impact directly to your central circulatory network. You do not need to step outdoors during volatile weather shifts. Simply utilize a clear corner of your living room or a sunlit balcony area. Perform this walking routine at a slightly faster pace than normal, keeping your posture straight, with both arms swinging rhythmically alongside your steps to activate the whole body. When you perform a fast 30-minute walk, contracting major muscles inside your thighs and calves physically pump your vasculature, stimulating the endothelium to release nitric oxide gas. Please click like, subscribe to Boston Community Health, and comment your age below. This life-saving biological gas naturally dilates your major arteries, improves vessel elasticity, and clears away developing atherosclerotic plaques. Brisk walking represents the most natural intervention to decrease systemic blood pressure, completely removing the dangerous mechanical shearing force straining your cerebral blood vessels daily. We transition smoothly to home exercise number 2, the continuous stationary calf raise routine. In geriatric medicine, the skeletal muscles within your lower calves are universally designated by physicians as the body's second heart. The absolute moment you elevate your heels, these lower leg muscles contract intensely, generating a powerful mechanical force that compresses deep veins, effectively pumping stagnant blood backward toward your heart. The physical execution of this specific routine is incredibly straightforward and perfectly safe for seniors. Stand upright facing a solid wall or rest both hands gently onto a sturdy chair back to maintain absolute bodily balance. Slowly utilize the strength of your toes to elevate your heels to their maximum threshold. Hold this muscular contraction for 1 brief second, then gently lower your feet back to the floor. Repeat this movement 15 to 20 times per set, completing 3 sets daily to optimize your deep venous blood flow velocity. Stagnant blood pooling within lower extremities due to extended hours of television or reading represents the core driver behind deep vein thrombosis formation. Once these localized thrombi detach from lower leg vessel walls, they travel swiftly through the venous circulation toward the heart and can launch directly into cerebral arteries, triggering an incredibly dangerous embolic stroke. This simple calf raise routine acts as a natural, zero-cost medical intervention to permanently disrupt blood stagnation, successfully shielding your central vascular network from embolic threats. We advance directly to home exercise number 3, the functional chair squat routine utilizing a heavy secure chair. This specific practice concentrates on activating the largest skeletal muscle groups inside an older adult's body, encompassing your quadriceps and gluteal complexes. These specific muscle masses function effectively as your body's primary glucose disposal factory. When these large muscle groups contract, they aggressively draw glucose molecules out of your bloodstream to fuel movement, helping stabilize and manage your long-term hemoglobin A1C levels naturally. Position yourself before the chair. Slowly lower your hips as if preparing to sit, keeping knees behind your toes, then stand upright. Please click like, subscribe to Boston Community Health, and comment right now. Managing blood glucose through this physical routine successfully eliminates inflammatory chemical agents, safely protecting your delicate endothelial lining from microscopic abrasions and the subsequent development of dangerous atherosclerotic plaques. Chronic elevated glucose inside your blood vessel system behaves exactly like microscopic shards of glass continuously scratching the inner lumen. This simple functional chair routine represents an incredible defensive weapon against prediabetes for seniors, keeping your arterial walls perfectly smooth without relying on heavy chemical prescriptions. Perform this movement 10 to 12 times per set, completing 2 controlled sets daily to systematically shield your cerebral vascular architecture right at the foundational level. We move forward to home exercise number 4, practicing simple Tai Chi forms or gentle breathing coordination movements indoors. This specific methodology does not target raw muscular power, but directly focuses on training your central nervous system and the cerebellum, the primary brain region governing body balance. As we navigate past age 60, the natural degeneration of the vestibular apparatus combined with a progressive narrowing of vertebral arteries frequently triggers severe vertigo and sudden unsteadiness in seniors. The deliberate, slow weight-shifting movements of Tai Chi actively stimulate your cerebellum to continuously map out new balancing pathways. This physical routine combined with synchronized deep diaphragmatic breathing successfully lowers systemic cortisol levels, preventing dangerous acute vascular spasms from occurring during daytime hours. Maintaining 15 minutes of this calming practice daily inside an airy environment perfectly shields older adults from sudden stumbles or losing coordination driven by temporary transient ischemic attacks. We advance to home exercise number 5 of the gentle shoulder rolling and mechanical neck pressure release protocol. This specific routine is incredibly well suited for execution immediately after you wake up in the morning. Performing slow shoulder rolls and gentle neck stretches safely elongates deep cervical muscle groups hardened during sleep, completely opening blood flow through your vertebral arteries toward your brain cells. This specific cervical mobility routine demands absolute clinical caution to avoid straining spinal structures already altered by chronological aging. Perform slow shoulder rolls in a circular motion from front to back 10 times, then reverse the direction from back to front 10 times. For your neck, gently tilt your head toward your right shoulder, holding for 3 seconds to elongate the left lateral muscles, then slowly transition to the opposite side. Absolutely avoid rotating your neck in rapid full circles or hyperextending your head sharply backward. Upon completing these 5 movements, you must memorize 3 life-saving safety principles. Please click like, subscribe to Boston Community Health, and comment your workout habits below. Rule number 1 is the talk test. The ideal clinical indicator of safe exertion is experiencing a mild elevation in heart rate, light perspiration, yet remaining fully capable of speaking complete sentences comfortably without gasping for oxygen. If during your brisk walking or chair squat routine, you develop rapid heavy panting, short breathing, and fail to voice a short phrase, that represents definitive clinical evidence that your cardiovascular system is severely overloaded. This sudden oxygen deficit triggers the sympathetic nervous system to launch adrenaline spikes, forcing systemic blood pressure and heart rate to soar, indirectly rupturing vulnerable atherosclerotic plaques within your arteries and activating sudden clot formation attacking the brain. We move directly to life-saving safety principle number 2. Absolutely avoid changing your bodily postures abruptly during and after your workout sessions. When an older adult performs exercises in a recumbent or seated position, the peripheral vasculature dilates to distribute blood flow toward working muscles. If you suddenly spring upward to a standing position, gravitational force immediately pulls blood volume down into lower body compartments like the legs and abdomen, causing cerebral blood flow to drop drastically. Clinicians define this specific circulatory drop as orthostatic hypotension. For an individual possessing carotid arteries pre-existingly narrowed by plaque, this sudden reduction in cerebral perfusion pressure can instantly trigger a transient ischemic attack, manifesting as dark vision, acute unsteadiness, or slurred words. To prevent this event, always transition between bodily positions gradually and deliberately. Upon completing your movements, remain seated quietly in your chair for 2 full minutes before attempting to stand up and walk. We advance to life-saving safety principle number 3. Strictly managing temperature factors within your immediate surroundings. Absolutely never exercising in spaces exposed to cold drafts or heavy wind. Sudden temperature shifts or cold drafts blowing directly against the base of your skull while your body is actively perspiring will instantly trigger widespread, severe peripheral vasoconstriction. This cold-induced vascular spasm will force your systemic blood pressure to spike toward dangerous record metrics within a matter of seconds. This abrupt pressure surge exerts immense mechanical stress on fragile atherosclerotic plaques within the carotid artery, expanding the risk of plaque rupture traveling upward to block cerebral oxygen. Therefore, always select an indoor workout space free from drafts, maintaining a stable, comfortable room temperature. Once finished, utilize a dry towel to clear perspiration and absolutely avoid bathing immediately. Coordinating these 5 home exercises with these 3 life-saving safety principles constructs the most comprehensive clinical framework helping you dominate your vascular health right at the foundational level. However, to maximize cerebral tissue protection, geriatric neurology recommends combining physical training with regular comprehensive laboratory screenings, first and foremost being your chronic blood glucose status via regular hemoglobin A1C blood tests. This clinical metric reflects a true longitudinal picture of your average sugar control over 3 months. Chronic elevated glucose inside your blood vessel system behaves exactly like microscopic shards of glass continuously scratching, causing chronic inflammation and tearing the delicate endothelial lining, heavily accelerating dangerous plaque buildup. The functional chair squat routine we evaluated earlier represents an incredible defensive weapon to accelerate glucose metabolism, keeping your hemoglobin A1C securely below the 5.7% threshold. Effectively managing this metric keeps your arterial walls smooth, completely eliminating inflammatory chemical agents destroying your vasculature. The second vital screening parameter requiring regular clinical investigation after age 60 to complement your home exercise focuses on tracking hidden atrial fibrillation using continuous Holter monitors. Atrial fibrillation causes the upper chambers of your heart to quiver chaotically instead of beating synchronously, forcing blood flow to swirl and pool inside cardiac cavities, generating large blood clots easily. When these large clots eject from the heart, their direct destination is a brain artery, instantly blocking a major branch, triggering a devastating cardioembolic stroke that tends to cause severe physical paralysis. The greatest clinical tragedy is that this condition frequently manifests as paroxysmal, meaning it occurs for only a few minutes per day and self-resolves, causing a standard 10-second office ECG performed at your doctor's clinic to miss it completely for years. A continuous 24-hour or 48-hour Holter monitor evaluation performed at home records every single heartbeat across a full day and night, successfully identifying those hidden paroxysmal episodes. Once identified early, cardiologists can prescribe targeted anticoagulant medications, which systematically reduce your cardiac-related stroke risk by 60 to 70%. Perfectly protecting your brain cells when combined with your daily lower leg calf raise routine. Combining these 5 home exercises, obeying these 3 life-saving safety principles, and performing these 2 laboratory screening processes grants you an incredible comprehensive medical roadmap to fully dominate your health destiny. You do not need to live under passive anxiety regarding hidden blood clots. Accurate clinical knowledge and proactive behavioral habits represent the most powerful shield protecting your personal independence and vital life energy past the age 60 milestone. I want to leave you with a profound clinical philosophy of geriatric medicine. The sudden stroke you successfully prevent through your intelligence and consistent daily movement will never make dramatic breaking news. The stroke you successfully prevent through your personal wisdom carries no intense resuscitation moments inside an emergency operating room. It remains completely quiet. The beautiful outcome of that wise prevention is just an ordinary morning, where your brain stays sharp, your steps remain steady, and you continue having warm conversations with family. Mainstream medicine and clinical research exist entirely to protect that quiet, priceless ordinary outcome for your life, ensuring you maintain your independent physical capabilities continuously without interruption. To transform this medical knowledge into a practical protective weapon, I want to provide a concise protocol consisting of 3 strategic questions to bring into your next wellness physical checkup. Question number 1 to ask your physician is based on my current physical status and my home exercise routines. What is the exact target blood pressure metric I should maintain? This crucial query forces the clinical conversation toward establishing a clear baseline, completely eliminating vague guesswork during home logging. Question number 2 to present: am I a suitable candidate to perform a hemoglobin A1C blood test and a duplex carotid ultrasound to evaluate my underlying vascular plaque structures? Question number 3 to ask is do I require an overnight 24-hour Holter monitor evaluation to completely rule out paroxysmal atrial fibrillation risks? Any good, highly competent physician will completely welcome these 3 strategic questions from you. They will respect your medical intelligence and appreciate your self-advocacy. Conversely, if your physician dismisses these questions or makes you feel difficult, that is important diagnostic information proving that doctor is simply not the right fit for your long-term longevity journey. Maintain firmness in seeking a healthcare professional willing to listen and partner with you during your long-term prevention framework. The ultimate goal of your healthcare at this stage must be protecting and extending your actual quality of life, preserving your independent living, your daily physical energy, and maintaining your capability to do what truly matters to you. You possess every single right to know exactly what a screening test is looking for inside your body. You have every right to understand what happens next if an abnormal finding is discovered. avoiding an unfeeling automated checklist. Now, let us bring all of today's vital medical insights together into a powerful protective shield. Your 5 simple home movements incorporate brisk walking to stimulate nitric oxide release, calf raises to activate your body's second heart, chair squats to accelerate glucose metabolism, Tai Chi to train the cerebellum for balance, and shoulder rolls with neck mobility stretching to clear the vertebral arteries. This represents your comprehensive framework to protect your cerebral vascular architecture naturally. Alongside these home movements, memorize 3 life-saving safety principles applying the talk test for intensity management, absolutely avoiding abrupt postural adjustments, and strictly managing draft-free room temperatures. Write down these 5 exercises and 3 safety parameters on a physical sheet or store them inside your phone app to serve as your daily safe movement guide. Share this educational video link with the people you care about most: a spouse living alongside you, an aging parent, or a sibling over age 60. The individuals who are at the highest statistical risk of facing this vascular storm will likely never search for these clinical studies online. Your small act of digital sharing today might become the exact reason someone's vascular system is saved from a devastating future neurological event. Your self-advocacy allows them to preserve their cognitive mind to live an independent, happy life of healthy longevity. I am Dr. Elias Thorne from the trusted medical organization Boston Community Health. Our professional mission is to deliver honest, international geriatric knowledge without fear-mongering to help you dominate your health destiny. Your brain remains a completely priceless and unique asset, deserving your highest level of wise protection daily through simple daily habits. Always stay sharp, stay highly informed, and master your own destiny. Within next week's educational series, we will deliver advanced clinical investigations targeting strategies to shield your cognitive memory architecture, preventing chronic neurodegenerative syndromes in older adults. This represents a highly critical subject, helping you construct your complete neurological defense network, maintaining your peak intellectual clarity regardless of the passage of chronological time. Remember clearly that these 5 simple home movements represent the golden key unlocking your active healthy longevity, systematically clearing dangerous arterial plaques without incurring any financial costs. Do not delay another single day. Select your favorite movement to initiate directly within your living room space tonight to actively shield your own brain cells. We will consistently remain here to deliver the most authentic, scientific, and evidence-based knowledge throughout your health autonomy journey. The compounding effect of these small daily movements creates a highly powerful anti-aging clinical intervention over time, preserving the non-stick integrity of your cerebral blood vessels. A sharp cognitive mind and physical independence represent your most priceless assets to thoroughly enjoy your peace and complete happiness alongside family. Please click like and subscribe to Boston Community Health right now and leave a comment below about the home exercise you prefer most. Wishing you continuous health, longevity, and see you next time.